So this is a dental clinic safety story. This is related to a veteran, a 55-year-old male veteran who presented to his dental appointment on June 28th this year with a chief complaint of dental pain on the lower left quadrant, pointing at a broken and decayed tooth number 21. He said he was in pain. Prior to this appointment on the 28th, last time he was seen in the dental clinic was back in December 2006. The protocol after the patient checked in with the front desk is for the assistant to take the patient back and take an x-ray. And so a panoramic x-ray was taken, and the dental assistant, after placing the patient in the treatment room, informed the provider, which was a dental resident, and myself, that she wasn't feeling comfortable with the patient's behavior. She stated that the patient was very strange, acting strange, he was looking up, laughing, and talking to himself. The dental assistant did not report any aggressive behavior from the patient at that time. So I decided to go in the treatment room with the dental resident to make sure everything was okay. And I personally review the medical history with the patient. The patient appeared to be a little bit lethargic, like behaving like somebody that wasn't something or had inhaled some type of alcohol, and he smelled like alcohol. So as part of the medical history, I asked a question about history of smoking and drinking, and to that question, the patient responded. He said, "Okay, doctor, I'm going to confess to you that before coming to the appointment this morning, I had to switch with some hard alcohol just to bring my pain down. And it did work because my tooth doesn't hurt anymore. But I did not swallow. I just wanted to be honest with you." So I appreciate the patient for answering the question and being honest. Then I asked, just for his safety, if he drove himself to the appointment, if he had a ride to go home. And he said that he did not. His wife worked near to the VA hospital, and she had dropped him off and was going to pick him up after the appointment. The patient was scheduled for an extraction of that tooth the next day and surgery due to a same-day cancellation. And he was really happy for that care. So the action in this case, as soon as we were informed by the dental assistant about the patient's behavior, I informed the available staff to stay nearby the treatment room outside and to identify the rest button just in case the patient's behavior changed into an aggressive one. And also I instruct the lead assistant to contact the police, the VA police, and we gave him a description, physical description of the patient, and the time of the appointment used to be alert in case the patient act inappropriate, and they could be addressed right outside the dental clinic or in the clinic if necessary. So I would say the message of this safety story is, safety in our workplace is not just a concern about our patients, but also about the staff. I think it's very important to pay attention to patients' behavior and don't be afraid to review the medical history, communicating any safety concern to your supervisor as soon as possible, and alerting other services in the hospital that could provide the appropriate support to ensure safety outcome. This go in line with the following principle of HRO: sensitive to operations. Being aware of the process and protocol to follow in any particular situation is a critical key to ensure safety. Preoccupation with failure. Even though the patient did not show any aggressive behavior during his dental visit, having the staff prepare with the right tools and instruction in case of an unexpected change in behavior occur is very important. Reluctance to simplify, identify and alerting the appropriate services in the hospital to promote safety and prevent negative outcome is of significant relevance. The VA Police Department was informed about the situation as soon as the concern was brought up to the service chief, and the police responded effectively by agreeing to be ready to act if necessary. They even offered to come into the clinic, but the patient, he had mentioned when he confessed he switched with alcohol, he said he just wanted for that information to stay in the treatment room. And I said, it's okay, it's part of the medical history, so it's not a problem. So I didn't want to aggravate the situation and have the police in the clinic. So I just told him to be aware in case they have to address the patient on outside, and thank God wasn't necessary. The other principle is difference to expertise. I think knowing your limitations and when to defer a case to allow the proper service to handle a particular situation is part of providing good quality care. Alerting the VA police of a situation that could have a negative outcome was the right way to act. The VA police counts with the appropriate tools, knowledge, and training to handle situations where patients present destructive and aggressive behavior. And that's all I have. Actually, just to complete the story, the patient came into his appointment the next day and the tooth was extracted. And at that appointment, he confessed, he said, Doc, I just want to apologize if I didn't behave properly yesterday. I had a little bit too much to drink. So the next visit, he did admit that he actually didn't just switch, but also swallow it, which we knew.
Okay. What a wonderful story, Dr. Rios. I think
Thank you.
that, you covered almost every area of HRO. But first of all, thank you to you and your staff for being very alert to the needs of the veteran. I can't say enough about listening to that story, how important it is for all of us to be sensitive to what's going on in our surroundings. Thank you for keeping your staff safe, and thank you for keeping the veterans safe. A wonderful story that Alicia, that of course it should be sent up through the network, and hearing that no matter what, you're all heroes in our eyes. So thank you.
Thank you so much.